Remember, even if you have no symptoms, if you test positive for COVID, it is still possible that you could spread COVID to other people. That's why knowing what to do if you test positive for COVID but you have no symptoms is super important. Guys, I'm going to tell you exactly what to do. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. All right. We are all trying to get our hands on tests. We are all trying to test and make sure we know what our status is, which is very important. I'm going to tell you exactly what you need to do if you test positive for COVID, yet you have no symptoms. And once again, that is important. The first thing you need to do if this happens with you is you need to isolate yourself. That means get in the house, stay out of the streets, and isolate. That means stay away from others. Do your best to stay away from others, even in your household, okay? That is number one, super important. The second thing you need to do is you need to pick up the phone and you need to call your close contacts. That's right. Let people know around you who you've been exposed to, they've been exposed to you, that you have tested positive to COVID and they have a potential exposure, so they can go ahead and do what is right for them, getting tested, all that kind of stuff, okay? Number three, consider calling your doctor if you got some questions. I know this is a very confusing time if this happens. As a family doctor, I often have patients that will pick up the phone and say, hey, look, this has happened to me. I just want to make sure I'm doing the right thing. So don't hesitate to pick up the phone and call your doctor if you just want to run this by them and make sure you're on the right track. Now, number four is probably the most important, okay? That is this idea of monitoring for symptoms. When we say monitoring for symptoms, it's paying attention to your body and paying attention. How are you feeling? If you're feeling perfectly fine, that's excellent. In fact, that's the best. That's ideal. We don't want you to develop symptoms. But symptoms do matter for a number of reasons, okay? Really, a lot of it has to do with, well, yes, your health, right? Because if you develop symptoms and they're severe, I want you to seek out medical care right away. But also, it helps determine when you can be around other people, all right? So let's say that you tested positive for COVID, you have no symptoms, and you don't develop symptoms. You don't get them at all. Yay, win-win. That means you can actually be with others 10 days after you turn positive via your test, okay? So you can just discontinue isolation 10 days after your positive test if you don't develop any symptoms at all during that period of time. Now, let's say you're monitoring for symptoms and actually you do develop symptoms later on. Then what you do is your isolation actually starts over, and the first day of isolation restarts to be the first day that you develop symptoms, okay? All of this is on the CDC website. Take a look at it for more information and for other details. Also call your doctor. But suffice it to say, if you test positive for COVID, you never develop symptoms, you can discontinue isolation 10 days after your positive test. Guys, go out and get vaccinated. Wear your mask, social distance, do hand wash, all that good stuff. Let's stay safe. I'm Dr. Jen Caudle. For those of you on Facebook, if you have not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. For exclusive content, consider joining my subscription group, Dr. Jen Superstars. You can find that right underneath the video. And for everybody on YouTube, please subscribe to my channel and click the little bell for updates. Guys, I'll be back soon with more videos.